Explain how simulation has evolved as a methodology in healthcare education and discuss its role in addressing patient safety challenges. Answer: simulation in healthcare has evolved significantly over the past few decades, driven primarily by the need to improve patient safety and address limitations in traditional medical education. Initially, simulation was limited to task trainers for practicing procedural skills, such as resuscitation for CPR training in the 1960s. Over time, advancements in technology led to the development of high-fidelity mannequins, virtual reality, and standardized patient programs. Patient safety was a pivotal factor in the evolution of simulation. Reports like the 1999 Institute of Medicine's To Is Human highlighted the prevalence of preventable medical errors, prompting educators to adopt simulation as a safe environment for learners to practice and refine skills without endangering patients. Simulation supports experiential learning, where learners can actively engage in scenarios, receive feedback, and reflect on their performance. Key aspects include skill mastery. Procedural and communication skills can be practiced repetitively. Crisis resource management (ERM). Team-based simulations improve coordination and decision-making during emergencies. Debriefing. Structured post-scenario debriefing enhances reflective learning, a cornerstone of experiential learning theories. Simulation continues to grow, integrating advances in artificial intelligence, augmented reality, and immersive virtual environments to enhance realism and engagement. Dr. Melissa is designing a simulation to train medical students on delivering bad news to patients. She plans to use standardized patients (SBS), but is unsure how to align the activity with best practices. What key steps should Dr. Melissa take to design an effective simulation using SBS, and how can she ensure the SPS contribute to achieving the learning objectives? Answer: Dr. Melissa should follow these steps. Define clear learning objectives. Objectives should focus on specific communication skills, such as empathy, clarity, and handling emotional reactions. For example, students will demonstrate the ability to deliver a cancer diagnosis empathetically while addressing patient concerns, but develop detailed SP scripts. SPS require consistent and detailed role scripts to portray patient emotions, history, and reactions authentically. Scripts should include cues for the SPS to respond to learners' statements realistically. SP training. SPS must be rigorously trained to ensure consistency across scenarios. Training should cover role fidelity, standardized responses, and constructive feedback delivery. Incorporate debriefing. A structured debriefing session is crucial, allowing students to reflect on their communication and receive feedback from facilitators and SBS. Evaluation and feedback mechanisms. Use rubrics to evaluate learner performance, focusing on both verbal and nonverbal communication. SPS should provide targeted, scenario-specific feedback. How does Kolb's experiential learning theory support the use of simulation in healthcare education, and what are its key components? Answer: Kolb's experiential learning theory is foundational for healthcare simulation as it emphasizes learning through experience. Simulation provides the concrete experience critical for ELT. Key components of ELT and their applications. Concrete experience. In simulation, learners engage in realistic scenarios that mimic clinical environments. For instance, managing a cardiac arrest using high-fidelity mannequins. Reflective observation. Post-scenario debriefing allows learners to reflect on their actions, decisions, and emotional responses. An abstract conceptualization. Learners analyze their experiences to derive theoretical insights, such as recognizing the importance of closed-loop communication in team settings. Active experimentation. Applying learned concepts in future scenarios or clinical practice ensures iterative improvement. ELT supports simulation by encouraging learners to actively engage, reflect, and apply lessons, fostering deep and meaningful learning. What is the role of needs assessment in simulation program design, and what methods can be used to conduct it effectively? Answer: needs assessment identifies gaps in knowledge, skills, or attitudes and ensures that the simulation program addresses these gaps effectively. Key steps and methods. Identify stakeholders. Engage educators, clinicians, and learners to ensure a comprehensive understanding of needs. Collect data. Quantitative methods. Surveys and pretests to measure baseline knowledge and skills. Qualitative methods. Focus groups or interviews with stakeholders to identify perceived challenges. Analyze data. Compare identified gaps against desired competencies. For example, if residents struggle with ventilator management, a simulation on this topic would be prioritized. Align with objectives and ensure the findings from the needs assessment directly inform the design of the simulation scenario and objectives. The Simulation Center Director, MS Garcia, notices low participation rates among nursing staff in the simulation training. Stakeholder feedback reveals scheduling conflicts and unclear perceived benefits. How should MS Garcia address these barriers to enhance engagement and ensure simulation aligns with stakeholder needs? Answer: MS Garcia should adopt a multifaceted approach, understand stakeholder perspectives, conduct interviews or surveys to identify specific concerns and expectations from nursing staff, flexible scheduling, offer multiple training sessions, including during non-peak hours, to accommodate varying shifts, communicate benefits, emphasize how simulation directly improves patient care and nursing skills, supported by data from studies showing reduced medical errors, involve stakeholders in planning. Nursing staff should have a say in selecting simulation topics, ensuring relevance and buy-in, provide incentives, consider offering continuing education credits or recognition for participation, relevant guidelines. The National League for Nursing Simulation Innovation Resource Center (NLS-CIRC) emphasizes stakeholder collaboration for successful implementation of simulation programs. What are the advantages and limitations of virtual reality (VR) in healthcare simulation, and how can it be effectively integrated into a simulation program? Answer: advantages: immersive experience. VR offers a realistic and controlled environment for practicing complex procedures without patient risk. For example, VR can simulate intricate surgeries, improving spatial awareness and motor skills, repetition and standardization. Learners can repeat scenarios to improve proficiency while ensuring consistent experiences across participants. Cost effectiveness over time. Although initial costs may be high, VR reduces the need for physical equipment and consumables in the long run. Scalable learning. VR supports remote learning, allowing access for geographically dispersed learners. Limitations. High initial investment. Development and maintenance of VR platforms can be costly. Technical barriers. Learners and instructors may face a steep learning curve for using VR tools effectively. Limited interpersonal skills training. VR excels in procedural skills, but may not adequately replicate the emotional nuances of patient-provider interactions. Integration strategies. Use VR for skills that benefit from repetition, such as laparoscopic surgery or anatomy visualization. Combine VR with other modalities like standardized patients to address limitations in soft skills training. Align VR scenarios with curriculum goals and conduct pilot testing to gather learner feedback. Relevant guidelines. The Healthcare Simulation Dictionary by SSH provides a framework for integrating emerging modalities like VR into simulation programs. Dr. Patel is developing a simulation to teach interprofessional communication in a high-pressure setting, such as a cardiac arrest scenario. She struggles to define measurable learning objectives that align with team dynamics. What steps should Dr. Patel take to create effective learning objectives for this simulation, and why are they critical to the program's success? Answer: Dr. Patel should follow these steps. Identify key competencies. Focus on interprofessional collaboration, situational awareness, and closed-loop communication. Use SMART objectives. Objectives should be specific, measurable, achievable, relevant, and time-bound. For example, by the end of the simulation, learners will demonstrate effective closed-loop communication by repeating back instructions during a resuscitation scenario in at least 90% of opportunities. Align with frameworks. Reference frameworks like the Team Steps ART model, which provides evidence-based tools to enhance teamwork in healthcare. Incorporate assessment metrics. Use tools like the Team Performance Observation Tool, TPOT, to evaluate the achievement of objectives. Why critical? Clear objectives ensure the simulation is focused, outcomes are measurable, and debriefing is targeted to areas needing improvement. Without them, assessing the effectiveness of the simulation becomes challenging. Why is aligning simulation activities with broader curriculum goals essential, and how can misalignment impact learning outcomes? Answer: alignment ensures that simulation activities reinforce the core competencies and knowledge required by the curriculum. Key benefits include reinforcement of learning. Simulations complement theoretical knowledge by providing practical applications. For instance, practicing catheter insertion after learning its indications in class strengthens retention. Resource optimization ensures time, faculty, and financial resources are used effectively to address priority learning areas. Assessment of competency. Aligned simulations provide evidence that learners can translate knowledge into practice. Impacts of misalignment. Confusion among learners. If simulations focus on skills not emphasized in the curriculum, learners may feel unclear about their priorities. Wasted resources. Investing in simulations that do not address curriculum gaps results in inefficient use of time and equipment. Mislearning opportunities. Critical skills may remain unaddressed, potentially compromising patient safety. Strategies to ensure alignment. Conduct a curriculum review to identify areas where simulation adds value. Collaborate with subject matter experts and stakeholders. Use assessment tools to track how simulation outcomes integrate with curriculum goals. Relevant guidelines. The SSH accreditation standards stress the importance of aligning simulation with organizational and curricular objectives. How do adult learning principles inform the design of effective healthcare simulations? Answer. Adult learning principles based on Malcolm Noel's andragogy emphasize the following. Self-direction. Adults prefer to take ownership of their learning. Simulations should provide opportunities for learners to make decisions and reflect on outcomes, such as managing a difficult airway scenario. Relevance. Adults are motivated when learning is immediately applicable. Simulations should mimic real-world clinical challenges to foster engagement and retention. Experience as a resource. Adults bring prior knowledge to the learning environment. Simulations can incorporate pre-briefing to connect past experiences with new challenges. Problem-centered approach. Adults focus on solving problems rather than memorizing facts. Scenarios like sepsis management challenge learners to apply clinical reasoning skills. Motivation. Adults are driven by internal motivators such as improving patient outcomes. Emphasizing how simulation practice reduces real-life errors reinforces its value. Relevant guidelines. The National League for Nursing's educational competencies highlights the application of adult learning principles in healthcare education. A hospital plans to implement a new simulation program to train staff on managing infectious disease outbreaks. However, resistance from department heads rises due to concerns about resource allocation and disruption of clinical operations. How should the simulation team address these concerns and secure stakeholder buy-in? Answer. The simulation team should conduct stakeholder meetings, present evidence on how simulation improves patient outcomes and reduces costs associated with errors, develop a cost-benefit analysis, highlight how the program can prevent costly errors, such as reducing infection rates by improving adherence to isolation protocols, pilot the program, run a small-scale pilot to demonstrate its impact with minimal disruption, engage champions, identify influential stakeholders who can advocate for the program and address resistance among peers, customize training schedules, minimize disruptions by scheduling sessions during non-peak times or integrating them into existing training days. Relevant guidelines. The Institute for Healthcare Improvement's IHI framework supports initiatives that improve care quality while optimizing resource utilization. In the context of healthcare simulation, what are 3 effective strategies to increase learner engagement during high-fidelity simulation exercises? Provide examples of their application. Answer. 3 effective strategies are pre-briefing with clear objectives. Establish clear learning objectives and explain the scenario's relevance to clinical practice. For example, inform learners they will manage a patient in acute respiratory distress, focusing on teamwork and communication. This aligns learners' expectations and reduces anxiety, fostering active engagement. Incorporating role play. Assign specific roles, such as team leader or bedside nurse, to each participant. Role play ensures learners stay actively involved, as they must apply their knowledge and collaborate effectively. Real-time feedback. During simulation pauses, provide constructive feedback highlighting what was done well and what could be improved. For instance, commend accurate triage while suggesting clear communication pathways during emergencies. How can simulation educators tailor their teaching methods to accommodate visual, auditory, and kinesthetic learners in a diverse group? Answer. Visual learners utilize diagrams, charts, and visual demonstrations of procedures. For instance, project vital signs trends on a monitor and show decision-making pathways during a cardiac arrest scenario. Auditory learners provide verbal instructions and use debriefing discussions to reinforce learning. Encourage learners to verbalize their thought processes and decisions during the simulation. Kinesthetic learners engage learners with hands-on tasks like inserting IV lines or performing CPR on mannequins. This direct interaction reinforces the learning experience. Educators must blend these approaches within a single session to address the group's diverse needs, ensuring equitable learning opportunities. Dr. Patel, a simulation educator, notices that Mary, a nursing student, repeatedly struggles with prioritizing interventions during acute care simulations. Mary often misses critical steps, such as securing the airway in an emergency. Dr. Patel wants to ensure Mary gains confidence and competence. What steps should Dr. Patel take to remediate Mary effectively? Answer. Dr. Patel should adopt a structured remediation plan, assessment, identify specific gaps by observing Mary's performance and discussing her thought process during debriefing, focus on understanding why airway management is overlooked. Targeted practice. Arrange additional simulation sessions emphasizing airway management. Break down the steps into smaller tasks and use task trainers to focus exclusively on the skill. Cognitive aids. Introduce tools like checklists or mnemonics GABC, airway breathing, circulation to support Mary's decision making. Feedback and reflection. After each session, provide detailed feedback and encourage Mary to reflect on her improvements. Confidence building. Celebrate small victories to reinforce her confidence in managing similar situations. What are 3 critical considerations when designing a healthcare simulation sent to optimize learning outcomes? Answer. 3 clinical considerations include flexibility of space. Create multi-purpose rooms that can transition between different clinical settings, e.g., ICU, ER, or this allows for diverse scenarios without requiring extensive modifications. Technology integration. Equip rooms with advanced audio-visual systems for recording and reviewing simulations. These systems facilitate detailed debriefing and learner self-assessment. Realism. Include lifelike medical equipment and supplies that mirror clinical settings. For example, use actual EKG machines and defibrillators to immerse learners in a realistic environment. The design should also consider accessibility, safety, and ease of workflow for instructors and participants. The Busy Simulation Center. Describe how workflow optimization can minimize downtime and maximize learner throughput without compromising the quality of education. Answer. Streamline scheduling. Use software tools to efficiently schedule sessions and allocate resources. Overlapping non-critical tasks like mannequin maintenance during scenario preparation reduces idle time. Standardized protocols. Develop and implement protocols for setup and teardown of simulations. This ensures consistency and reduces setup errors, saving time. Staggered sessions. Run multiple scenarios in parallel using different rooms or spaces. While one group debriefs, another group participates in active simulation. Effective communication between staff members and regular review of processes are essential to maintaining smooth operations. What is the role of debriefing in enhancing learner engagement, and how can it be structured to maximize its impact? Answer. Debriefing is a critical reflective process where learners analyze their actions and decisions in a simulation. To maximize impact, structured approach. Use the GAS method. Gather, analyze, summarize. Begin by gathering observations, analyze critical incidents, and summarize lessons learned. Facilitator role. The facilitator must ask open-ended questions such as, what went well and what would you do differently next time? Peer involvement. Encourage participants to provide feedback to one another, fostering a collaborative learning environment. When well structured, debriefing deepens understanding and reinforces the application of knowledge. Explain why a one-size-fits-all approach is inadequate in simulation-based healthcare education and propose a solution. Answer. Learners have diverse backgrounds, experiences, and learning styles. A one-size-fits-all approach fails to address individual needs, potentially leading to disengagement. Solution. Employ blended learning techniques by integrating visual aids, verbal instructions, and hands-on activities. Conduct a learning style assessment at the start of the course to tailor activities accordingly. Provide flexible learning pathways such as self-paced online modules combined with instructor-led simulations. What is the role of formative assessment in identifying and addressing learner deficiencies in simulation-based education? Answer. Formative assessment provides real-time insights into learner performance, allowing instructors to identify weaknesses, highlight specific areas needing improvement, such as communication during a Code Blue scenario, tailor interventions, develop personalized remediation plans, including extra practice sessions or targeted feedback, monitor progress. Continuously evaluate learner growth, ensuring deficiencies are resolved before progressing to advanced tasks. Tools like video analysis and rubrics enhance the objectivity of formative assessments. The hospital plans to build the simulation center. Sarah, the lead simulation educator, is tasked with ensuring the facility meets current and future needs. The center must accommodate different healthcare disciplines and provide space for interdisciplinary training. What considerations should Sarah prioritize to achieve this goal? Answer. Sarah should prioritize interdisciplinary design. Include flexible spaces adaptable for various scenarios, such as a multi-bed ward convertible into smaller rooms. Technological infrastructure. Ensure robust IT systems for high-fidelity simulations and real-time debriefing. Sustainability. Choose modular furniture and equipment to adapt to changing healthcare education needs. Incorporating feedback from stakeholders across disciplines will ensure the design meets diverse requirements. How can simulation educators balance high learner throughput with maintaining quality in debriefing sessions? Answer. Time management. Limit simulation scenarios to critical learning objectives, reserving adequate time for debriefing, efficient group dynamics. Use small groups to allow in-depth discussions without exceeding time constraints. Facilitator training. Equip facilitators with tools to lead concise yet impactful debriefs, focusing on key performance indicators. Balancing throughput and quality requires careful planning and resource allocation. What are some strategies to address implicit bias during a healthcare simulation session? Discuss their importance and provide guidelines for implementation. Answer: implicit bias refers to unconscious attitudes or stereotypes that affect decision-making and interactions. In healthcare simulations, it is crucial to address implicit bias to foster an inclusive and respectful learning environment and ensure equitable patient care practices. Strategies to address implicit bias. Pre-simulation training on bias. Educators should include implicit bias awareness as part of pre-simulation orientation. Tools like the implicit association test I can help participants recognize their biases. Reference: implicit bias training aligns with guidelines such as the Institute of Medicine IAM standards for cultural competency in healthcare. Diverse representation in scenarios include diverse patient profiles, age, race, gender, socioeconomic status, to expose participants to a range of cultural and social contexts. Facilitator reflection. Facilitators should undergo training to recognize and mitigate their biases, promoting fairness in feedback and scenario debriefs. Debrief with sensitivity. Create a psychologically safe space where learners can reflect on potential biases that surfaced during the simulation. Implementation importance. Addressing implicit bias enhances participant awareness and prepares learners to handle real-world situations with greater empathy and competence. It also aligns with Joint Commission standards requiring culturally sensitive care. Dr. Patel is preparing a simulation session in a culturally diverse hospital. One of the cases involves a 65-year-old patient from a religious minority who refuses a critical treatment due to cultural beliefs. How should Dr. Patel adapt the simulation to ensure cultural sensitivity while meeting educational objectives? Answer: steps to adapt the simulation. Understand cultural context. Research the religious or cultural beliefs relevant to the scenario. This ensures authenticity and sensitivity. Embed interdisciplinary collaboration. Include roles such as a cultural liaison or spiritual advisor in the simulation to demonstrate how healthcare teams address cultural conflicts. Encourage ethical decision-making. Frame the scenario to emphasize patient autonomy and respect for beliefs, challenging participants to consider ethical frameworks like Beauchamp and Childress's principles of biomedical ethics. Debrief on cultural sensitivity. Discuss how participants balanced respecting cultural beliefs with advocating for patient safety. Guidelines followed. This adaptation aligns with American Nurses Association on a Code of Ethics standards for respecting cultural diversity in healthcare. What are the key components of a proper incident report in healthcare simulation, and why are they critical for mitigating legal risks? Answer: key components of an incident report. Objective facts. Clearly document what occurred, avoiding subjective opinions. Who, what, when, where. Include details about participants, the simulated scenario, and the time and location of the incident. Immediate actions taken. Record any steps taken to manage the situation or prevent harm. Potential contributing factors. Identify environmental or procedural issues that may have contributed. Follow-up plan. Outline measures for future prevention or corrective action. Criticality for mitigating legal risks. Proper documentation supports transparency and accountability. It is crucial for compliance with regulatory standards like those from the Occupational Safety and Health Administration, OSHA, and ensures legal protection if incidents are scrutinized. How can simulation educators evaluate the effectiveness of incorporating diversity into simulation scenarios? Discuss at least 3 methods. Answer: methods to evaluate diversity effectiveness. Pre- and post-simulation surveys. Assess learners' attitudes and knowledge about diversity before and after the session using validated tools like the Cultural Competence Assessment Instrument. CCI debriefing analysis. Use structured debriefing tools such as the Debriefing for Meaningful Learning (DML) framework to gauge participant reflection on cultural components of the scenario. Objective structured clinical examination (OS) metrics. Measure competencies in communication and cultural sensitivity through performance-based assessments. Guideline alignment. These methods align with Accreditation Council for Graduate Medical Education (ACME) diversity and inclusion standards. Nurse Smith encounters an error during a simulated pediatric emergency where a participant administered the incorrect dose of medication. The facilitator observed the error but allowed the scenario to continue. How should the incident be addressed during the debrief? Answer. Steps to address the incident. Create a safe debriefing environment. Emphasize that the simulation is a learning experience, not a punitive one. Use the plus delta technique to explore strengths and areas for improvement. Analyze the error's root cause. Facilitate discussion on factors contributing to the error, e.g., communication breakdown, stress. Teach corrective strategies. Highlight the importance of double-checking doses and leveraging team members to cross-verify relevance to legal and risk standards. Discuss the parallels between the simulation and real-world implications under the National Patient Safety Goals (NPSG) by the Joint Commission. How can simulation educators incorporate cultural sensitivity into healthcare scenarios, particularly when dealing with patients with limited English proficiency? Answer. Strategies for incorporating cultural sensitivity. Use interpreters in simulations. Incorporate professional interpreters to simulate realistic communication challenges. Teach alternative communication tools. Train participants to use visual aids, translation apps, and body language effectively. Focus on patient-centered care. Emphasize listening, confirming understanding, and showing empathy. Cultural competency training. Pre-simulation modules on cultural awareness prepare participants for nuanced interactions. Relevant guidelines. This approach aligns with the national CLAS standards, culturally and linguistically appropriate services, which emphasize communication accessibility in healthcare. A simulation participant documents an error incorrectly during a training session. The error involved giving medication at the wrong time, but the participant's report states that the wrong medication was administered. How should the facilitator handle this documentation error during debriefing? Answer. During the debriefing, the facilitator should first create a non-punitive environment where participants feel safe discussing errors. Begin by asking the participant to describe their thought process during the documentation. This encourages reflection and self-assessment. The facilitator should then point out the discrepancy between the actual event and the documentation, explaining the potential consequences of such an error in a real clinical setting, such as miscommunication, legal liability, or harm to the patient. Emphasize the importance of accuracy in documentation as a critical skill for safe healthcare practice. Provide guidelines such as documenting only observable facts, e.g., time of administration, and avoiding assumptions, e.g., inferring a wrong drug was given. Highlight the use of tools like incident reporting systems to improve accuracy and prevent future errors. Finally, connect the discussion to Joint Commission standards, which require complete and accurate documentation as part of patient safety protocols. By fostering an educational approach, the facilitator reinforces the value of precision without discouraging active participation in the simulation. What are the challenges of adapting simulations for global healthcare contexts, and how can educators overcome these challenges? Answer. Adapting simulations for global contexts poses several challenges, primarily cultural differences, resource availability, and legal variability. Cultural differences, such as attitudes toward gender roles, communication hierarchies, and decision-making styles, can affect how participants interact with scenarios. For example, some cultures may expect healthcare providers to defer to senior staff, potentially stifling open discussion. Resource availability is another issue. In low-resource settings, healthcare professionals may lack access to advanced equipment or medications simulated in high-resource environments, making the scenarios feel unrealistic. Legal and ethical variability adds complexity. Different countries have unique consent laws and professional practice standards, requiring simulations to address these distinctions explicitly. Educators can overcome these challenges by incorporating cultural competency training, ensuring participants understand diverse patient needs and behaviors. They should adapt scenarios to reflect available resources, such as simulating alternative treatment protocols for low-resource environments. Collaboration with local healthcare professionals can ensure cultural and contextual relevance. Maria is designing a simulation to teach compliance with accreditation standards. During the scenario, one participant neglects to check patient identification before administering treatment, leading to a near-miss incident. How should Maria address this during the session and post-simulation? Answer. Maria should address the incident constructively to maximize learning. If the simulation allows, she might pause it immediately to highlight the error and its implications, linking it to the risk of patient harm and legal consequences in real-life scenarios. For example, administering treatment to the wrong patient could result in adverse reactions or delays in critical care. Post-simulation, during debriefing, Maria should guide participants through a discussion on the importance of patient identification protocols, such as the Joint Commission's Universal Protocol, which mandates at least 2 patient identifiers, g. Name and date of birth. She can provide real-world case studies illustrating the consequences of such errors, fostering a deeper understanding of the stakes. Maria should also emphasize system-based solutions like integrating barcode scanning technology into workflows to prevent similar mistakes. This ensures participants not only recognize the importance of patient safety but also develop practical strategies to uphold these standards. By framing the incident as an opportunity for improvement, Maria promotes accountability and builds participants' confidence in managing future challenges. Why is it critical for simulation educators to conduct risk assessments before implementing high-fidelity scenarios? Answer: risk assessments are crucial to ensuring the safety and effectiveness of high-fidelity simulations. These assessments help identify potential hazards to participants, such as physical strain, psychological distress, or technical malfunctions in simulated environments. For instance, scenarios involving physical activities like CPR may carry a risk of injury without proper equipment or guidance. From a legal perspective, risk assessments demonstrate due diligence, which can mitigate liability if adverse events occur. Institutions can use this documentation as evidence of proactive safety measures in compliance with Occupational Safety and Health Administration (OSHA) guidelines. Risk assessments also ensure educational quality. They help facilitators identify and address gaps in scenario design, ensuring the simulations align with learning objectives without introducing unnecessary risks. For example, incorporating a fire emergency drill without adequate planning could cause undue panic, overshadowing the intended learning outcomes. To conduct effective risk assessments, educators should use standardized tools, involve a multidisciplinary team, and create contingency plans for identified risks. By doing so, they protect participants while maintaining the integrity and realism of the simulation experience.